Hi there, this is Nurse Beth from allnurses.com, and I'm glad to be here with you. In this short video, we're going to talk about resumes, and I will give you 4 main points that will really help you when you construct your resume when you're looking for that important job. Resumes are really important. A lot of times it's the first impression, I was going to say only impression, but hopefully not, that an employer has of you, and you only have a few seconds when the nurse recruiter is scanning your resume to make a favorable impression and to stand out. And remember that your resume is not about you, it's about the employer. They're looking for somebody who will stand out and be a good fit for their organization. So how can you do that? Here's some things to avoid, and here's some things to be sure to include. So the first one is to avoid fluffery or avoid fluff. What is fluff in a resume? Fluffery in a resume are listing, including content that doesn't add value or that is a given. An example of fluff for a new grad would be the tendency to include a long list of clinical rotations and where they went and what they did and so on. Often you'll find this on the top half of the first page, which is prime real estate in a 2-page resume, and it does not add value. Every other applicant with the same qualifications, meaning that they went to nursing school, also attended all their clinical rotations, and there's nothing about that that will help you to stand out. By the same token, an experienced nurse who lists a list of duties such as passed medications, started IVs, performed assessments, those are all a given for any nurse in clinical practice, and they do not help you to stand out. Far better to list accomplishments of the skills and qualities that you want to highlight. For example, in nursing school, did you serve as an officer, maybe president of your class, or did you lead on projects? Were you the go-to person to organize study groups? And so on. Did you do any community volunteer work? Volunteer work, by the way, is really important to include in your resume, and sometimes, all things being equal, the volunteer work will earn you the point to put you over the top and land that interview that somebody else doesn't who is just as qualified as you. Now, an experienced nurse, think of the accomplishments and contributions that you've made to the organization that you have already been working at. An example would be served on a unit-based committee to reduce patient falls by 60% over 6 months. Now that's a really good one because it's an example, and it also includes a metric. So anytime you give an example that includes a metric, a measurable outcome, that's really a good thing, and you want to include that. Now those kind of things will be remembered and will help to make you stand out, unlike a list of duties or tasks or clinical rotations. So avoid fluffery, do include accomplishments. All right, the second thing, you also want to avoid cliches. It's very easy to use cliches. By cliches, I'm referring to phrases such as has a strong work ethic, team player, detail-oriented. These cliches do not add value, but they do take up space. They don't add value because every other applicant is detail-oriented and a team player and has a strong work ethic. So far better to list actual, authentic examples of the skills that you want to highlight. So for example, let's say that you worked as a waitress and your customers loved you, and your return customers came in and they would always request to sit in your area. Now that would be a great example of people skills, but far better than just saying demonstrates people skills. Maybe you earn the highest tips as a waitress in that same job. Again, that would be excellent because it would communicate and illustrate that you have strong customer satisfaction, understanding, and skills. And by the way, customer satisfaction, patient satisfaction is really big in healthcare right now. So nurse managers are looking for employees who have that skill, and you would have just demonstrated that. So avoid cliches, but do include examples. The next thing that you want to do is be sure and individualize your resume to each organization that you apply to. It's not best to send out a generic resume to hundreds of different organizations without targeting what makes that organization different. For example, let's say that you're applying to an acute care facility, and when you do your due diligence and find out about them, you find out that their ethnic population is largely Hispanic. 60% of their patients are Hispanic, and so you would naturally then choose to include that you have an understanding of conversational Spanish. Of course, if you do, you would include that, but it will help guide what you're going to include and what you're not going to include. Everything you include really should have a purpose. Remember, again, it's about the employer, it's not about you. How can you show that you will fit in to them and their culture? Then you want to be sure to include keywords from the job description itself, because they're telling you what they're looking for in the job description. For example, a compassionate person, you would want to include that in your resume. And keywords also will help you with the applicant tracking or ATS system that is going to pick up on certain pre-programmed keywords from the job description. So do individualize your resume to each employer. Try and learn their mission and values statement, and if any way possible, try and find out their culture. You do that by trying to talk to somebody who works in the organization. Tell me what it is about your organization that you like. Tell me what's different. For example, in the facility that I work at, it's a faith-based organization, and it's very customary for the team leader to lead in a short prayer in huddle in the morning and in the evening. So knowing that going in as the applicant is advantageous. If that aligns with your values, you can speak to that, and that lets the employer know that you would be a good fit. How would you speak to that in a resume? Anything that might show that you have the same values, such as having volunteered at a church camp, camp nurse, maybe you taught vacation Bible school, or so on and so forth. Those kind of things will stand out. So individualize each application to each employer. Oh, another thing too about that, look and see what service lines they have. Are they certified, for instance, stroke certified or chest pain center? Are they starting a new service line, perhaps oncology? Again, that will help you what to pick and choose in your resume if you know what it is they're all about, what they stand for, where they're going. So you're going to definitely individualize your resume. And then finally, the formatting of your resume is very important. The best content will be put in the wrong pile, the do not call pile, if you make grammatical mistakes, spelling errors, your syntax is not correct, and it's not cohesive, and so on. If that is not your skill, have somebody with proofing and editing skills help you and look at your resume, I'd say several times before you send it in, before you upload it. It is definitely not unheard of for a recruiter or the first person who screens your resume to notice errors, and just on the base of that, assume that you may not be careful on the job if you're not careful in your resume. And so you really don't want that to happen to you. So be really, really careful and proof your resume yourself and have a couple other people do it for you. Do not put references available on request. That's just no longer done. It's a given that an employer will ask you for your references if they want you to include them. Some point along the line they probably will, but it doesn't need to be on your resume. Another thing that is really questionable as to whether it adds value or not, I recommend not doing it, would be an objective statement, especially if your planned objective statement is pretty much to say, I would like to get the job that I'm applying for, because that's a given. And unless you have written that very creatively in a manner that stands out, and that would be really hard to do, then it's better just to leave that off, because really it doesn't add value, it doesn't really help you to stand out. So just to summarize, you're going to avoid fluffery. Instead, you're going to give examples that highlight the skills that help to show that you fit in. You're going to avoid cliches. You are going to give examples. You're going to individualize to each employer, and being aware of the keywords that you're going to find in the job description itself. You're going to turn in a document that is professional looking, has lots of white space, avoid dense text, use bullets to draw interest and highlight certain items that you want to highlight, and have absolutely zero mistakes in it. I hope these tips have helped you, and I hope that you'll stay tuned for the next installment, which is going to be cover letters and application essays. And you can also find me at Ask Nurse Beth at allnurses.com, and several articles on career and interviewing and a wide range of topics at allnurses.com, and also my blog nursecode.com. Thank you.